Good afternoon, everybody. Good afternoon, everybody. I'm Scott Schenkelberg, the President and CEO of Miriam's Kitchen. I am so grateful for you taking your time to join us today to learn more about what's happening at Miriam's Kitchen, what we accomplished across this last year. I'm joined by two great leaders of Miriam's Kitchen, Adam Rocap, our Deputy CEO, and Kirsten Quinlan, our Chief Program Officer. We really look forward to getting into what we accomplished over this year and our mission to end chronic homelessness in Washington, D.C. It's been a challenging year at Miriam's Kitchen. 2025 has been really hard. It's painful to see what has taken a better part of a century so quickly dismantled. My career has been focused on social justice, which for me is simply the belief that we have a society that has more than enough, and we aren't very good at sharing with others, and that we could share enough that everybody has a happy and healthy life. I believe that more than ever. The pandemic taught us not only that we have a generous community that looks out for those in need, but we have a government that can do courageous, expensive, and difficult things to improve the lives of poor and vulnerable people. In the pandemic, there were enhanced unemployment benefits, child tax credits, enhanced food assistance, expansion of health services, and an eviction moratorium. Together, these actions decreased adult and child poverty and homelessness. When these benefits expired in March of 2023, we at Miriam's Kitchen saw the beginning of greater need. Miriam's Kitchen started to serve more meals. Poverty rates increased and homelessness rates increased. But that wasn't enough. We started blaming homeless and poor folks for their own circumstances. We don't provide affordable housing, so you are homeless. How dare you sleep in our parks? We don't provide adequate and early health care. How dare you be unable to work? Native-born Americans can't or won't do certain jobs. How dare we ask folks from other countries to come in and do those jobs? I have a unique privilege at this moment, though, for 30 years, 23 of them at Miriam's Kitchen, to know so many people who hold that same belief in social justice, that we can share better. They don't just believe it, they design more just systems, fight to see them come to life, meet with folks in crisis, and work with them to get them to a place of health and happiness. In this terrible year, I'm so proud of the ways that we showed up for a just society. We housed homeless folks, we fed the hungry, and we clothed the naked. We spoke truth to power. Housing solves homelessness, not sweeping people away. Thank you for joining today and for your commitment to social justice. Miriam's Kitchen has accomplished amazing things even in this moment of adversity. As long as there is need, thank you for making sure that Miriam's Kitchen is not going anywhere. I'm going to show, in a moment, we're going to see a short video of all the different outreach that we did across the end of last summer with regard to the August 11th executive order that unfortunately displaced many of the guests that we served, many homeless individuals in our community. So I'm very proud of the work that Miriam's Kitchen did in getting out the message that housing solves homelessness, not sweeping people away.
All right, Dana, so you're there in D.C.
and could have on the district's unhoused population.
President Donald Trump saying that the city's homeless basically have two
are now
options.
being offered, as we speak, as we are speaking, an ultimatum. You can go to a shelter or you can go to jail.
And it begs the question of where they will be taken, who will be taking them, and what about their human and civil rights?
It has been really harmful to our unsheltered folks who are living in encampments. Moving people from place to place at random is not helpful. It's not a solution. Isolating them from their outreach workers. We have street outreach workers who are connecting people with housing. They're building relationships. And once people move, it's hard to find them again.
Also, things like tickets, criminalizing, arresting people just makes the problem worse. It makes it harder for people to exit homelessness.
Organizations like your own trying to do work out there, but many times coming up against the wall of funding and not being able to do everything that you would like to do.
Scrambling, and we're already scrambling to begin with.
Miriam's Kitchen Policy Director Andy Wasenick says their outreach team covers 33 square miles of the district. And this week, they've been working around the clock to try and find shelter.
And so our street outreach team at Miriam's Kitchen continues to go out. They were out last night into the evening hours, and they were out early this morning, including right as we speak, making sure people have what they need, the information, connection to resources or shelter if that's what they choose. We're providing mobile phones to folks.
I applaud Miriam's Kitchen, and I wish that we could be replicated 10 times as many Miriam's Kitchens all over the place, so there could be services.
That's easier said than done.
House people, that's the solution to homelessness, not just feeding them, not just putting them in treatment, not just all these things, but like actually putting a roof over their
So
head.
after you go through all that, will they still be homeless? They'll still be homeless. Okay, housing solves homelessness.
And Miriam's Kitchen says they will be opening a new shelter this fall near Union Station to provide bridge housing.
I hope you got a sense of the work that we did over the last few months to really, show up for our guests, to talk about, the daily struggles they have, and how in this moment they are being forced to, hide and disperse and really lose connection with services. I'm extremely proud of Miriam's Kitchen's work in showing up for that, not only in this moment, but throughout the course of our existence. I now have the pleasure of turning it over to Adam Rocap, our Deputy CEO, who's going to talk a little bit about our program achievements over the last 12 months.
Great. Thanks, Scott. Just like Scott shared, I've been here at Miriam's for almost 20 years, and this past year has been, one of, if not the hardest environments that we've been through. But through it all, the MK team, when facing policy changes, rising needs, the shifting environment, the team really showed up, stayed united, and really adapted with heart and innovation. And part of what I'm so excited to share is that, every day and every program and all the advocacy, what we do, we're always focused primarily on one thing: how are we helping our guests go from homelessness to housing? And this past year, we housed more guests in 1 year than we ever have in the history of Miriam's Kitchen. So there's 243 people who are housed today who were not housed a year ago. That's happening also in an environment when food costs are really high and more people are coming to Miriam's Kitchen for meals than ever before. So for the second year in a row, we've now served more than 100,000 meals in a year. One of the exciting things that I'm very proud about Miriam's Kitchen is that we have a wide breadth of programs to face environments like this. So we have meals, social services, street outreach, housing, advocacy. We have 2 new programs that we'll talk about a little bit later in our health initiatives and bridge housing. But I'd love to focus first on the things that have been the foundation of all that Miriam's Kitchen has been doing for a long time. Our meals. It's often what people know about us the most, and which is as important as ever. Not only because there's so many people with food insecurity, and you can see how over the past couple years, we've gone up to serving over 100,000 meals per year. But that's really the foundation on which we build relationships in the dining room. That's how people meet case managers. That's the pathway from meals to housing. And I'm going to have Kirsten share a little bit more about one of our biggest efforts in housing, which is our permanent supportive housing program.
Thank you. Yes, and I'm Kirsten Quinlan. I'm the Chief Program Officer at Miriam, so I help support a number of our different programs. So I'm happy to talk about our permanent supportive housing program, where we are currently supporting 310 individuals in every ward of the city. We work all across the district to support people in a voucher-based support program. So people receive a voucher that pays their rent, and then they have wraparound case management services that really provide tenancy support, making sure people have what they need so they don't return to to homelessness again. And as you can see on the slide, we have over 99% retention rate, which means nearly every single person that we have helped move into housing is still there after 1 year, and we're very proud of that and of our team. And then some of our other programs, our social service program, which works in tandem with our meal program down in the dining room, and that's like what a lot of our volunteers are involved with, guest services. We're serving, as Adam said, more than ever of our meals, but also to our guests. We work with people to obtain income and benefits. We're working with people to connect to mental health services and to physical health services. I really want to call attention to our mental health services, which we've helped more people than ever before connect with mental health services. And then also we have great health partnerships, which we're going to talk about later, but we have a long-standing partnership with Unity Healthcare, who comes to the dining room regularly, as well as some other programs, just to reduce barriers and make sure that people who are coming to our dining room who might not be able to make it across town for an appointment here and there are able to see providers here on site. And then our street outreach team is doing a lot of that same work, but wherever clients are, right? Whereas in our dining room, people come to us because of the meals and the services. Our street outreach team is trying to do that same work, finding people who may not be connected or who may not want to come in to a busy place like we are, or maybe don't know about us yet. And so in our area and in over almost 50% of the district where our area is to cover for our street outreach team, we're really the front line of services that people are encountering, making sure people have things to stay warm or to stay cool, as the case may be, have food or know where to go for food, and then especially with all the executive order action that happened in August, making sure that people have information and that they have the resources to stay safe and be safe. So we're really proud of our street outreach team, particularly this summer.
And the federal policy environment has been challenging all year, continues to be challenging on so many different levels, from the amount of housing funding that's being scaled back, coming cuts to really vital healthcare services and insurance and other federal programs that our clients rely on. But really the hardest time of the year was August. So during the month when there was an executive order, not only creating a federal takeover of DC from the federal government, but there was really specific action against people experiencing homelessness in DC. And it's hard to overstate the really traumatic input or impact that had on our guests who are staying outside. We saw so much displacement, people being told that they can't stay in a certain place or you have to move. And all of that means that our outreach team, which has built relationships over years, is spending all of their time just helping people react. We're losing touch with people. It's getting harder for people to access services. And there's this incredible trauma and mental health strain if you're someone who's experiencing homelessness staying outside for all of this, these threats and these displacements. And it's not only impacting our guests, but it also impacts our staff, in particular the outreach team that has to be that first responder and who has shown up in an amazing way, both the MK outreach team and a lot of our outreach partners that we work with. But that all takes a toll. And I've been so proud of our team and the way that they've responded and the way they've been showing up for our guests. But was one of the hardest months and continues to be one of the hardest times I've ever seen at Miriam's Kitchen. In the face of that, we have the ways that our direct services show up to lessen the harm to our guests and to keep focusing on solutions no matter how hard the environment is. But a huge part of Miriam's Kitchen is that we also are loud and proud advocates. So our advocacy program, not only did so much to help coordinate a rapid response network across a lot of partner organizations, who I'm so thankful that we were able to be working with, but we are always doing things on the big system level. How are we pushing the local government to fund housing, which we know is the solution to homelessness? How are we convening working groups to say, hey, when we do have the housing funding, how's that funding being implemented the fastest way possible. How are we making sure that it's no more than 90 days to go from a client hearing that they got the great news that they'll be able to move into housing to they actually have keys in their apartment. And also one of the things that I'm the most proud of at Miriam's Kitchen is the way that we work with amazing, seasoned guest leaders and advocates, people with lived experience of homelessness, speaking, doing speaking engagements, being involved in advocacy, and then also helping create broader ways for staff and other volunteers and other partners to be involved in advocacy. We've been very active this year. That covers a lot of the core programs that we've had for a long time, the way that we're showing up in the dining room, in the street, in our housing program, and doing advocacy. But one of the bright spots and amazing parts of this year that's been so hard has been some of the new exciting things we're launching. I'm so excited that we're launching multiple health initiatives right now. Targeted programs that are addressing the huge intersection between health and homelessness. We launched a patient navigation program this year that is busy and having a huge impact, has already enrolled and served 68 clients. And we help clients who have a lot of medical needs trying to navigate a very complex medical system. And with our volunteer navigators and medical students and staff who are involved have helped those clients make 87% of their appointments, which is huge compared to what it's like when you don't have a patient navigation program in place. And we're also continuing to dream and build big things. We're hard at work to launch a medical respite program at the East Street Bridge Housing Program. And there's such a lack of, there's several good medical respite programs, but we need more beds, and we're excited to be part of an effort to bring more at East Street, which is our other exciting thing that has just launched and that we're gonna have Kirsten share more about.
Yes, our newest program that we're very excited about is our East Street Bridge Housing Program. It's a transitional shelter that will have capacity for up to 190 residents. And the idea is that it's a medium-term place for people to live and become stable between the time that they get matched with a housing voucher or other housing resource, but before they move in. There's a few months there when there's a lot of paperwork to do, there's a lot of appointments and things like that, and it's a place that we can help people get stable, have access to their support teams, their housing teams, so that they can be really pursuing their housing opportunity. And so we're really excited about that. It just opened about 2 weeks ago for our first clients, and we have 14 residents there as of today. It's a dormitory style program. It's not a low barrier shelter where you might have 40 or 50 beds in one room. It's more dormitory style where it's 2 beds to a room, sometimes 3, with a shared bathroom in that room. Meals are provided on site, and we have on site case management support as well to help people put in place whatever they might need to remain stable once they move into their place. So we're very excited about our newest program and its possibilities and ramping up our capacity there.
So one of the things I'm most proud of this year is that we've also worked to really change public perceptions around homelessness and about Miriam's Kitchen. So Miriam's Kitchen has been around for over 40 years, and I think for the vast majority of people, across that time, they've thought of us as a great place for people experiencing homelessness to go and get meals. And while that is true, it is also true that we are really passionate and believe that ending chronic homelessness is possible, that homelessness ends because of long-term affordable housing for individuals. And one of the things that we want the public to believe, and many of you supporters know, is that we know that if we are good at helping people understand housing first, which is the idea that everybody deserves a place to call home, and that we should lower barriers to people getting into long-term housing. That helps spur policy decisions that will allow for more funding and more type of that housing. And we've seen that be successful year over year over year. We're hitting some headwinds right now, but we're going to keep up that fight to continue to work towards Housing First to make sure that everybody who is experiencing homelessness ultimately has a place to call home. One of the other things I'm proud of is that Miriam's Kitchen, we know our issue areas, we know our guests, we stand up for them, and that we believe that as a trusted leader in this space that we should continue to work to those kinds of solutions to be able to uplift members of the community who also have the same beliefs, but we have been leaders in that space and want to continue to provide that leadership. And we really also believe that centering our guests in our work is really critical to being not only authentic to the work that we're doing, but helping people understand the real stories behind the people who are affected by this. We have an amazing guest leadership group, an amazing speakers bureau, and we try to get them out in front of any number of groups to be able to share authentically their stories. All told, what I'm proud of this year is we've shifted from just a perception that we provide great meals to people who are experiencing homelessness to really being a leader in Housing First advocacy. Because we know housing ends homelessness, not meals. It's an important part of the journey, but that's not the end of the story. And I'm going to talk about celebrating our community. So one of the things that I'm also very proud of is we've really given opportunities for members of our community to come together to show support, and we do an annual celebration in the spring. It was in May of 2025. Just this past month, we did a chef's table in our dining room, which is the first time we ever had this event. These are all opportunities for public members to participate in these events, of course, to help us raise much needed funding for the work that we do. And we've also pivoted and tried to do a couple of new models. Like we did a murder mystery night last month, and we've been doing bingo nights. We have an upcoming Run for MK, which is now an annual event, which both happened last year and will be happening on November 15th this year. So if you want, go to our website. There's lots more information on ways that you can sign up for that event or participate in any number of events at Miriam's Kitchen. And our website is www.miriamskitchen.org. So again, you should be able to go and find any amount of information on the website. And for people who have been patiently adding questions to our chat, waiting for answers, we're about to turn to you in a moment. So thank you for your patience with all of that. So I'm about to close up our presentation. Again, many thanks to Adam, many thanks to Kirsten for their incredible leadership, for the information that they shared today. But even though it's been a challenging year, and we know it's been challenging on many, many fronts, we also know that truth is truth. Ending chronic homelessness is possible. Homelessness ends because of housing. So for all the myths, for all the different ways that people are trying to reinterpret this moment, we are going to stay true to the course. And as long as you guys support us, as long as we continue to have a community that believes in these values, we will be here as long as there is need. So thank you so much for your time today. Thank you for all the ways that you've engaged with Miriam's Kitchen. And I am excited to answer any of the questions that you may have posted. I'm grateful. Thank you.
Let's talk a little bit more about the bridge housing.
Sure.
People want to know what is the plan for 2026 around the bridge housing program.
Okay.
Sure. Yeah. So our plan is to ramp up as as we are able to our maximum capacity of 190 beds. And so right now we're at 14. We just opened 2 weeks ago, so we are busy hiring more case management staff as well as standing up the building. Still, it's a brand new rehabbed building, so it's still very much sort of building the plane as we fly it. And so we look forward to building capacity. We have a great operations team in place. We have some case management as well, and we're going to build up our staffing so that we can support the full building of 190 residents. Another thing that we are expecting to happen in 2026 is, as Adam mentioned earlier, the medical respite. And I'm not sure if there's anything else you would like to say about that.
Yeah, we think it's a great opportunity. Like I said, there aren't enough medical respite beds in DC. And for anyone that doesn't know what medical respite is, picture a time when you had to have a surgery. Maybe it wasn't even that serious of a surgery, but when you were leaving the hospital, someone said, hey, what you need to do for the next week is to totally rest. Stay at home, that's how you're gonna get healthy. For many of the guests that we work with, that's not an option. there isn't a home where you can go and focus on your health and rest. So we're going to be working with healthcare partners, hospitals, others on how are we creating a really great program where people who are in that situation can come and not only be coming to a place like the E Street Medical Respite for their healing and recovery, but then also infusing everything that the bridge housing is about through and through, which is how are we helping people move into housing? How are we helping people find the creative solutions so that there's a permanent next step for them? So we're really thrilled about doing that. We're thrilled about all the ways that bridge housing is not only going to be helping all residents, with, finding the right solution for housing to them, but it's really going to be meeting critical needs of the moment. I mean, some of the people that we're going to be serving are people who are linked to a housing voucher, and it can take a long time to go from being matched to that program and moving into housing. One of the things that can slow things down is if people don't have a stable place where they can be to go visit apartments and fill out paperwork and meet with their case manager, that can slow things down. Things like bridge housing solve that. It's also a unique opportunity to sort of meet the moment we're in now, where for people who are staying outside, who often say no to a regular shelter, but who would say yes to something like bridge housing, when the climate is such that it is less safe and less comfortable to be staying outside, being part of a solution that's offering things that people say they actually want is hugely important.
Julia says, how can we help? What are the greatest needs right now that volunteers and fans of MK can meet?
I'm happy to try to answer that. So, I mean, it's all of the above. I mean, we're an organization that about half of our budget is from, public contracts and grants, so money from largely DC government. The other half is, private fundraising. Committed, generous individuals in the community, foundations, corporations, who generously give of their resources to make sure that we can provide the kinds of services we need to for our guests. So obviously, donate. This is a challenging time for the DC economy. If you're in a position that you're able to continue to support the work that we're doing to serve very vulnerable homeless individuals in our community, we greatly appreciate that. We always need volunteers, so our meal program is the primary place that most of our folks who are interested in volunteering go to volunteer. We absolutely encourage that. And, there are a couple of events coming up. So in November, come out for the Run for MK. I'll be there. Love to meet you in person. So come out for that. There's always a way and a moment that you can engage with Miriam's Kitchen, whether it's financially, through volunteerism, through community activism, through supporting our advocacy work. There's a whole host of needs.
We have another question. How do we face an environment where you don't know what is coming next?
That's a great question. I think really what we need to do is make sure that we, and I think about it, in terms of, your family, or in terms of, any personal situation that you want. You may not know what's coming next, so you have to think about, well, what do I have? What resources do I have at my disposal right now? And who are the people around me that can support me in this moment? And that's true of our organization as well. We have an amazing team. We have incredible leaders like Kirsten and Adam, and we have a staff of nearly 100 people that are all dedicated to our mission of ending chronic homelessness. I have great faith in them, and I know that as the crisis that happened in August and their response to it, they stepped up. They have stepped up time and time again. So it's really about taking stock of the people that you have around you, taking stock of your finances, making sure that you have a reserve to be able to meet that need. And then, I guess this is from Frozen 2, do the next right thing, which is this moment where we don't know what's coming next, we don't know what the next crisis will be, but all we can do is continue to stay true to our mission, and then take the next course of action that aligns with that mission and supports our guests.
Another one, what is the biggest myth around homelessness, and how would you counter it? I don't know if Adam or Kirsten?
Yeah, I mean, I would say that the biggest need is always housing. So, you know, from our core, everything that we're doing in all of our direct services, in all the advocacy work, is about housing, because we know that housing is what ends homelessness. So that's how, if you just look from a program and staff level, we're tirelessly trying to connect people to whatever available housing resource there is. In these times when there's fewer like housing programs that have space, we're working really hard, partnering with our guests who are very resilient to try to figure out what are the creative solutions that are possible, thinking outside the box, doing whatever we can. And that, you know, all leads to advocacy around housing, to keep getting to the root causes of homelessness, to keep getting to the solutions of scale. We can't tire of doing advocacy. In some level, this is the hardest time to do it because you can do lots of advocacy, you can work on the city budget, and there is no new housing in the city budget. You know, to some people that might mean, I guess we should give up. But that is the time when we least can give up, and it's where I'm the most proud of our Miriam's Kitchen advocacy team, our supporters, our guest leaders who we partner with, who, you know, are really standing up and making sure that we're continuing to speak out, continuing to do everything we can to help people access housing. And for the times when we can't, that's when we're helping people make sure that they have enough food, make sure you're able to keep health insurance benefits in an environment without it's getting more complex, making sure you can see your doctor, helping you to get whatever income you can. I mean, we're always doing everything in a really client-centered way to say, what do you need today or this week the most, and how can we work together to help you get what you need?
Another question, after the crisis in August, what kind of ripple effects have you seen? What are your teams on the ground seeing? Maybe Kirsten, that's something for you.
Sure, yeah, August was certainly unprecedented in terms of its scale and the stress that was placed upon our guests and our staff. I think that we're still seeing some of the ripple effects, right? We're trying to do more support of our staff to make sure that they have what they need and the support that they need in order to sustain themselves in this work and that they feel the support of the organization. And for our guests, I think it's a lot of making sure we're still finding people, right? As Adam mentioned earlier, like one of the effects is that we lost touch with people as folks were swept away or moved to Virginia or moved to Virginia by choice, or, you know, went into shelter or kind of retreated further into a place where we couldn't find them for their own safety. And so I think a lot of what we're doing is catch up on, you know, making sure we can still find people that we have relationships with so that they can continue on whatever journey they might have been on already towards housing or anything else. So those are some of the ripple effects that we've been seeing.
So we have a comment. Robert says, thank you, Adam and MK. Housing is healthcare and it saves lives. That's a comment. We also have another comment from Rochelle Ellison, who is part of the Speakers Bureau.
Yes.
And she says that MK made a huge impact in my journey in amazing ways, she says.
No, and it's amazing to hear. Thank you, Robert and Rochelle, who are both amazing guest leaders who advocate, who speak out, who educate, and who, you know, frankly, I look to personally, and many, you know, of our, you know, advocacy team and other stuff, like, look to their wisdom and their perseverance, and that's part of the larger MK community that is pulling together in the hard years and the easy years, and is consistently, you know, yelling from the rooftops that, you know, housing is a human right, housing is healthcare, all of these things, and we're so thankful to be partnering with them and so many others day in and day out.
All right, and let's close with this one. This is a difficult work. What keeps you going? How can we support, once again, the staff and care for the caregivers?
Maybe each one of us can take a turn at that. How about
Scott?
that? I'll start. I mean, again, I think I said this at the very beginning of our presentation today. You know, I've had a career focused on social justice. I believe strongly that we are called as humans to make sure that everybody has what they need to have a healthy and happy life. And I believe also that we live in a society that has more than enough for that. And those beliefs haven't changed at all. You know, in fact, in moments like this, I feel even more strongly that, you know, what we're fighting for is right, that what we stand up for is right. And does it not mean there are hard times? There are certainly hard times. But it's easy when you're working with amazing people. You know, it's easier when you're working with great people in the community. I can't tell you the number of people that I have encountered over the last couple of months who have said to me, I started volunteering because I have to do something. I started donating because I have to do something. And when people feel that urgency and they stand up, it gives me a lot of energy. And so I'm very grateful for the ways that our community continues to support Miriam's Kitchen staff and, of course, Miriam's Kitchen's guests.
Kirsten?
Sure. I think for me, what sustains me is the relationships with guests and with staff, and seeing the results that are happening. We know what works. We know what the solution is, and our housing works. And our permanent supportive housing program, for example, we know the housing first model is successful. And I started here as a case manager many years ago, and I've seen the growth of Miriam's Kitchen. And like every time we have opened a new program, I have felt even more committed to knowing that we are providing solutions, that we are connecting people who need it the absolute most in our city to the resources that are available. So that's really what keeps me going.
Adam?
Yeah, I think for me, it's a lot of things that are similar. It's even in the hard times, how are we, you know, remembering all the good and exciting things that are happening? And sometimes that is just at the person-to-person level, when we hear stories across our programs of the person who's been, you know, staying outside under a bridge for 10 years, who just moved in and opened the door to their own apartment with their keys. The person who, it's just a huge win that we helped them get to a medical appointment, and now they're getting the treatment for the cancer that we weren't sure was going to happen. So it's not only for me personally hearing those stories and making sure to connect with them, but even as a community, like of staff and with, you know, volunteers, like how are we reminding each other about those stories, about this is why we're here, this is why things are possible. So it's anything from those small things, or like I love to run, so sometimes I'm, you know, running, let's say at the beginning of the workday before I start work, and, you know, we're really fortunate that we're close to the mall, and so I run down by the Martin Luther King Memorial, and as I'm running by, I, you know, listen to his prophetic voice and read those words about the way we as a community are called to justice, and that we can do big things. And then you can keep running, and you can run through the FDR Memorial and say, you know, we have been through as a nation things like the Great Depression, and spoken, you know, the words of truth about how we need to judge ourselves as a society not by what the richest people have, but what the least of these have. And sort of connecting into that big arc of what are sort of the, you know, proudest and most amazing parts of the history, you know, for me, helps me, you know, just keep that faith, keep that optimism that as we keep pulling together and keep fighting in this mission, that all the really important things that we want to see happen are possible.
Okay. Well, thank you, everybody. It's been a pleasure sharing with you today. I hope you have a great rest of your day. Take care.
Thank you.